Everyone, my name is Skylar and I'm doing case 1.1, Professionalism and Nursing. We have Diane here who works as a nurse at a hospital. She has 2 years experience and works on the general medical floor. She generally deals with diabetic patients and stroke patients. She is also a team leader and gives direct care and plans basic care for other nurses to carry out. She does work long hours and extra hours, and that includes writing procedures. She attends weekly meetings that have to do with physical therapy, occupational therapy, and social services to better educate herself so she has more knowledge. She does not have any kids, so she doesn't have any prior commitments or other responsibilities outside of her nursing duties of the hospital. She does, however, have a strained relationship with Arlene, and I'll explain that later. Diane says it is more professional to attend these meetings and wants more out of her job than just a paycheck. She wants to show the importance of nursing and thinks nurses can do more and contribute more than just giving medicine and baths to patients. She does, however, admire Arlene for her skills and integrity. Diane argues that these meetings lead for a better care for her patients by learning more and doing more. She does feel hurt that Arlene doesn't give her the support that she wants for working more and doing more than what is expected. Here's Arlene's point of view. She is a single mom with 3 kids, so she's got quite a lot of other responsibilities and commitments other than her nursing duties. She's busy with that. She argues that Diane is foolish to work with no pay. She also calls Diane a super nurse. And she says others who have responsibilities are put in a bad light because Diane is doing so much more. Arlene also argues this increases the expectation across other nurses in the hospital. Arlene also says it is unfair to those who are paid an hourly rate, and it holds nurses down. Arlene also says it is not helping nurses to be at a professional status. And lastly, nurses are not professionals like doctors and lawyers, and those people get paid the big bucks because they are more professional. Okay. So looking at some counter arguments here, we've got Diane, who's a team leader, so she's supposed to set the bar higher for other nurses to follow. She's doing more in hopes that others will follow. Diane also wants more out of her job than just a paycheck. She generally cares about her patients and wants to give them the best care possible, and by doing this, she attends these weekly meetings and learns as much as she can to give them the best care. Okay, next. Doctors are not always available. Crazy things happen in a hospital all the time, every day. So doctors aren't always going to be available. Sometimes they may have to take care of a patient over here that has bigger issues than your diabetic patient over here. So if Diane learned something by those weekly meetings that help prolong the life of the patient over here, then I think it'd be worth it until that doctor is able to come over and help them. Next, the professional status. I think do more, get more. Arlene wants to do the bare minimum and doesn't think that Diane should go do these weekly meetings and go out of her way and do it without no pay. It doesn't harm anyone. It only benefits the nurses and their patients. By knowing more, you can do more and help more. And maybe in the future, by everybody doing more and helping more and learning more, maybe their pay will be compensated in the future and nurses will be held to more of a professional level with the more things that they do. And if it's too much for people like Arlene who have prior commitments like their kids, maybe they can come together and do a weekly meeting and they all can collaborate and share their knowledge. It doesn't all have to be on one person. They can take turns and work as a team, because not everybody doesn't work as a team. Nothing's going to work. Okay, now looking at the ethics side of it, I've got Immanuel Kant, Aristotle, and Thomas Hobbes. Looking at Immanuel Kant, we've got the greater good. That is his belief. He would probably support Diane in this situation because he believes in helping others. Aristotle is very similar to Immanuel Kant. He would also support Diane, I believe. He thinks or believes in being a good person, and by being a good person, your actions will follow effortlessly. So to Diane, again, it's not about the money, it's about her patience. So she would be a good person, and her actions, it follows effortlessly. It doesn't bother her that she's working more without any pay. Arlene, on the other hand, would relate more to Thomas Hobbes. He is more selfish and would rather do the bare minimum than go above and beyond like Diane. So I can personally relate to this. I'm not a nurse, but however, I was a preschool teacher for a little while. And as a teacher, I went above and beyond. I was paid hourly, and I put in a lot of overtime that did not get paid for. It didn't bother me. It wasn't about the money. It was about helping my students. I mean, granted, they were preschool, but a lot of them had some issues. We worked in a low-income community, so all of our families were low income. They were struggling to find houses. They didn't know where their next meal was going to come from. A lot of them were in homeless shelters. A lot of them had a drug addict for parents and were trying to get them rehabilitated. So going above and beyond, I think, only benefited these kids, same as Diane is doing in her situation. She's going above and beyond to help her patients. I went above and beyond to help my kids. I reached out to the families and I got them the help that they needed to rehabilitate their lives. And if they didn't, you know what, I would give the better life for their kids. I would help them find something better, which is a greater good for society, helping out, kind of like what Immanuel Kant says, and also like Aristotle, being a good person, your actions will follow effortlessly. It wasn't a big deal to me. I cared about my students, and seeing them succeed was the greatest thing in the world. Now I work with autistic kids, and I do as much research as I can to help them. Okay, this child's struggling with this. What can I do to better help them? Diane is doing that, and Arlene is not giving her the support that she needs to work together as a team. Like at my job, if we didn't work together as a team with a child, that child was not going to get the help that they needed. Everybody needed to be on the same page, kind of like what Diane and Arlene need to do. They need to get on the same page and help everybody. Arlene maybe doesn't have to put forth as much effort as Diane because she does have prior commitments and responsibilities, such as her 3 kids. So that is my view on it, and the ethics view on it as well. If you guys have any questions, comments, leave them below. I will try and answer them. Thank you very much. Bye.